Hey, Joe. Hello?
Hello, can you hear me okay?
Yeah, let me just pause this a bit. So I have on, this is Sleep Balance Academy, and I have on the line Dr. Joseph Salk and Cindy Johnson, who is head of Scalers to Stethoscopes, is how you say it?
Well,
Tell me about yourself.
it's a tongue twister. If you can pronounce it, you pass.
Okay.
Scalar to schedule, and then we have our medical dental arm, scalers and stethoscopes.
Okay, so you have two arms. Okay, good.
Two arms.
And I know, because I talked to you earlier this week, you already have your clients screened for sleep apnea, and as part of your routine examination procedure that you teach hygienists to do. Is that right, Cindy?
Absolutely. Yes.
And Joe brought to my attention last week the fact that the ADA has recommended that all dental practices screen for obstructive sleep apnea. And then I realized, I think Joe made it possible for me to realize that lawyers are now looking at possibly a way of revenue, gaining revenue by suing dental offices that don't do this. Is that right, Joe? I'm gonna introduce Joe too.
Yeah, it goes along the same lines as where other recommendations were followed by more litigation down the road. A really good idea was several years ago, the ADA encouraged practices, made it encouraged to screen for oral cancers during their follow-ups and their regular, hygiene checkups and dental checks. And you miss one or two cases and it's a big deal. And now the attorneys are in there going, well, this is the standard of care. If it was encouraged, that means it's a standard of practice.
That's right.
So if you do not happen to find that, now you're liable.
Right.
And sleep apnea, we now, after, many, many years, know with very well-supported information that it is a known very high risk factor for all cause cardiovascular poor outcomes, meaning uncontrolled hypertension, atrial fibrillation, stroke, heart attack,
Right.
You name it. It's a cardiovascular risk. And now that the ADA has encouraged once again, all, not some, not high risk, but all dental patients should have at least a screening questionnaire on the record that states whether they are low, medium, or high risk for having a sleep disordered breathing problem, or sleep apnea problem, needs to be documented. And obviously, if it does turn out that it's high risk, there needs to be some action where it needs to be referred off for an investigation. So we want to be way ahead of this. We want to, number one, give the most exemplary level of care, whole body health for the dental patients. And we also want to stay ahead of any legal potential outcomes from not being the highest level of practice.
So Joe is, So Joe is my co-partner with Sleep Balance Academy. We bring allied health professionals into sleep apnea care that has not been done before. Chiropractors, functional medicine, hygienists, dentists. We are doing something that's not been done in the industry. And the thing about it is, you can have hygienists learn to screen for sleep apnea, and they can present this form to their dentist that may not be well trained in sleep apnea. And the whole office can be trained by Sleep Balance Academy if they become interested. Now, they don't have to. Once they screen for this problem and they identified a person that needs more testing, all they have to do is go through a couple of forms and then get the person referred properly to a health professional who does treat it. On the other hand, those who want to know more about sleep apnea care and this dentistry's role in it can continue to enroll in our program and learn more about sleep apnea care and get a comprehensive sleep apnea education. And the unique thing about Joe is he's double board certified in sleep medicine, and we haven't had a medical champion of dentists in this area ever that I've ever seen. He's the only one. And he's a huge advocate of dental providers taking care of patients in this area. And
The reason why,
yeah,
sorry to interrupt there, Rick, but
yeah.
one of the reasons behind putting together the Sleep Balance Academy is I believe there's at least 8 or 10 states that have put into their state practice, dental practice acts,
Right.
in action what the ADA has encouraged as far as sleep apnea screening. On top of that, they're adding a certain level of continuing education that needs to be provided for the dentists and the dental hygienists and the dental staff
Right.
that shows some level of baseline understanding of sleep apnea and its impact on dental care.
Exactly.
So we want to be ahead of the game and really make it easy, facilitate the learning process. So this is a big job. I mean, for all practices to have to screen all dental patients, that's a global impactful statement by the ADA.
And once a year, that has to be done as a minimum.
Yep.
Right.
Once a year is the requirement. We actually do it at every visit.
I think that's,
Yeah.
That's exactly where I would do it too. I'm gonna show a couple of forms, and then I'm gonna have Joe show the ADA recommendation and some slides on this. But let me just share my screen real quick and show you what we have as a simple way of screening for patients. And I had shared this with you earlier this week, Cindy, but I'm going to show these two people right now. So I'm going to share my screen. There we go. And I'm going to expand this. Can you all see that?
Absolutely.
And is it
Sure.
a large screen or is it a small screen?
It's good. It's full screen.
Full screen.
Full screen.
Okay, so here we go. I'm going to bring this down a little bit. So the screening form is here, okay? I'm going to get this out of the way a minute. The screening form that we've developed, and Joe, I've changed this a bit. You can see down here in the Epworth score section, I've written in here that if you get an Epworth score of 7 up to 10, you get a score of 4 points. And if you get a score of 10 or higher, I've given it a score of 6 points. And you can see down here that the threshold for ordering a sleep study is 6. So
Sure.
that means that if they get a 7 or up to 10, they're not yet qualified for a home sleep study, but a 10 or higher in the Epworth score would qualify them for a sleep study.
Sure.
And on the other hand, if they have a 7 or less in the Epworth score, but they get any of these, like this one here, a 4, then a 4 plus a 7, or a 4 plus a 4 would be 8. So they qualify for a screening. And any
Sure.
of these up here in the stop bang area would also, if they have any kind of score at all of 2 or more in this Epworth area, they would qualify for a sleep study. That makes sense?
Yeah, well, and the data supports that at least 50% of dental practices have 50% of the population in their practice is undiagnosed.
Right.
So
I have this,
yeah, this looks like it's going to screen a lot of folks.
I think it's going to work. And then you've got this section 3 here is included because I wanted to include the chiropractic functional sleep medicine people in this screening process. And of course, they
Sure.
would do all this anyway.
Sure.
But I wanted it more comprehensive to cover more of the allied professionals. Now I have a explanation sheet that's 2 pages long that tells people how to use this form, and that goes along with this. So people who are members of the Sleep Balance Academy get that, but those who are just watching this screening video, I will offer that to you as well. Okay.
Yeah,
Now,
it's a nice, straightforward screener form. It looks simple to get filled out and put in the chart.
because most insurance companies want this Epworth score or the stop bang, and this is kind of a modified stop bang up here. Okay.
Yeah. The nice part about that is you can copy and paste it into your clinical note templates.
Absolutely.
So for efficiency with time, that's one of the pushbacks that, of course, you all know we get with clinicians who
This
claim
is very fast. This is very fast.
Yeah.
And I agree with that. A screening process should be fast. We have a workflow. Now, this wouldn't apply to anybody who goes beyond just the screening and testing and referral. this workflow sheet is been developed, and I've modified this, Joe, since I talked to you last. But this is for people going through treatment in a dental office and how to work with your healthcare provider specialist. And then the last one I wanted to show you today, there's more forms to show you, but the Sleep Balance Academy acknowledgement forms. Once you've done a screening, and if you've recommended further testing for a patient, then and they refuse, then they should fill out this and sign this form saying they've been informed that they need further evaluation of possible sleep apnea. They've refused it, and it's an acknowledgement that they know that they've been informed about this, and you place that in the patient's record, okay? So it's just a disclaimer for a patient.
Yeah, I think that's an extra bit of insurance for the practice. If someone doesn't, if they're that obvious and they're not willing to follow through with your recommendation, at least look into it. They should probably have something in writing that says they're basically going against our recommendation,
just
opinion.
like you would a refusal for periodontal treatment form. Do you do that, Cindy, a refusal form for perio?
Absolutely.
Okay.
We take it a step further, and if they continue to refuse, we dismiss.
All right, very good.
Sure,
Exactly.
that makes sense.
You know, and that might be something we need to do here, Cindy, is a continuing to refuse form. Okay, that's very good. Thank you. Now I'm going to show one last thing before I turn this to Joe, and this is our Sleep Balance Academy website. Now, this is where people go to get their education. It's CEU approved, and you can go through a complete training in sleep apnea care. This is basic sleep apnea care. And as you can see here, we include dental, functional medicine, chiropractic office. We also would want to, I should put in here the allied dental professionals as well, like hygienists. And so you can go through here and become a member. Members are allowed to see the, there's Joe. I love that picture, Joe.
You look so happy, Joe.
Isn't that great? I just think that is such a happy picture. I love that picture. Yeah. Joe, I think, laughed at it when he first saw it.
I did. I did. He posted it. I'm like, okay, there a barrel laughs there, you know.
They had a lot of fun. But anyway, let's go back a minute here. I just want to show you the join now. And then, so when you look at this, you can look through here and you can see our curriculum. Now, as module 0, this module 0, you can go through all these free of charge. This is on snoring, okay? So you can get actual CEUs at free of charge on these modules right here. This is called module 0, Fast Start program, okay? And then when we get to the module 1, then this is a membership only, but you can see the topics that we are already talking about on this module 1 to get complete training in sleep apnea care for dental offices. And you can see that there are actually more modules here than that. It goes beyond this. Matter of fact, we can go further. Module 2 for myofunctional therapy, and we have telemedicine for our professionals who want to have their patients treated telemedicine by myofunctional therapy. And then module 3 is EMF. We are going to add more modules to this program as we go on, okay? All right, so now, Joe, I'm going to go back, stop the share, back to you, and I'm going to hit and give you a share view so you can go ahead and show the mandate about this. Where do I do that, Joe?
So
let me just
go share screen. I can go ahead and
yeah, that's what I'm doing. Yeah.
once you enable it.
I'll make a co-host. There you go.
There you go.
Go ahead.
Okay, so I'm going to try to share screen here. So we'll go share screen. And we recorded this introduction to dental sleep medicine for the dental team last week because we feel more and more practices need a general introduction to just the basics of what sleep apnea is, basic terminology, basic screening, and then give them some physical examination findings here. So in the end of the presentation, we also highlighted that the American Dental Association and their proposed policy statement on the role of dentistry in the treatment of sleep-related breathing disorder, which is the umbrella of snoring, upper airways resistance, and sleep apnea. They really wanted 5 points to be drilled home in their recommendations. And it basically says dentists should screen patients for OSA. And this needs to be part of a comprehensive medical and dental history to recognize symptoms such as sleepiness and the side effects associated and the symptoms of sleep apnea. And then once they find out whether it's a high risk, then the dental office needs to refer these patients as needed to the appropriate physician. Now, sometimes it could be a sleep specialist. There's not a lot of us out there, so typically it would be a well-informed family practice doctor, or even if there's a Department of Transportation examiner who's a chiropractic physician who has partnered with the practice, they can help in coordinating these screens. And then number two, the ADA says that oral appliance therapy is appropriate for mild and moderate obstructive sleep apnea and for patients who fail CPAP or are contraindicated in the severe category. So this really opens up the whole spectrum for being able to supply your patients with appropriate therapy. And then it needs to be prescribed by a physician and then delivered by the dental team. Mm-hmm. And then of course, once that's done, there all should be a consent for treatment as well as potential side effects. And then a part of that include a monitoring system to make sure that you reduce the risks of side effects. And that's what our Sleep Balance Academy really wants to allow people to have access to is, you know, this team between us has treated probably over 15,000 patients over almost 20 years. If it's happened, we've probably seen that presentation and we know how to recommend addressing that. And then finally, in number 5, the dentist who provide oral appliance therapy or OAT to the patient should monitor and adjust the oral appliance for treatment efficacy as needed. So at least annually, they need to be followed up on. And the ADA is also subscribing to the use of unattended cardiorespiratory home sleep monitoring, or level 3 sleep monitoring. There's different levels of complexity. And the dentist trained in the use of these portable monitoring devices may assess interim results when you're adjusting or titrating the therapy, meaning we need to document that level of continuing ed to these dentists and dental hygienists and the support staff, right, that they've documented some level of understanding of how to be a part of this sleep apnea treatment team, interdisciplinary team. Now, mind you, if we wanted to, we could highlight the next slide. Just what the recommendation here is, how I've compressed it, is the dentists are encouraged to screen patients for sleep-related breathing disorders, which would include their allied dental staff who are part of that team. Then refer to appropriate physician. Once patient has been screened, if they are high risk, start screening. And that's all patients should have updated health history. And then as long as you keep in the back of your mind, if you're seeing a patient and they have any of these issues, even before you do the screen, you know they're high risk. High blood pressure, type 2 diabetes, stroke, heartburn, atrial fibrillation, if they've had recent weight gain, if they have a fairly high alcohol use, especially in the evenings. Screen them with the Epworth Sleepiness Scale, Stop Bang, Berlin questionnaire, if their body mass index is greater than 30, or if they're male or woman and they're older than 60, because once you pass that, women typically, when they're through menopause and perimenopause, the androgens have actually taken over and the estrogens are less ubiquitous. And so the collapsibility of the airway actually catches up to men after the age 60. So literally, once you've been healthy enough to reach that level of age, now you get the lucky moniker of being, you know, twice as likely of having sleep apnea than when you were younger than that age. So if it's 25% of the population, it's 50% of the population once you pass 60. So, and of course, if you have any bruxing or grinding. I want to do just a real quick review of what you can expect if you were to review that video that we did. This was the first slide. It goes through the spectrum of breathing disorders, terms for screening, How do you grade sleep apnea by the apnea-hypopnea score? We review what a breathing problem looks like with sleep apnea. We show you a video of someone actually going through the episode. And then we show you different examples of home sleep monitors that are level 3 that different offices may have access to. And we provide these through online homesleepstudy.com, along with interpretation, prescription, letter of medical necessity. These are all the body systems that sleep apnea can affect. And of course, then we review the different types of screens, and we go a little bit more in depth in how to utilize those, including doing neck circumference, and how to grade these different questionnaires and what different disorders to be looking for. We also discuss the examination and the different physical findings you need to be looking at while you're in the airway, doing the dental hygiene and the dental follow-ups, and some of the procedures that might be necessary, and of course, comorbid bruxism. Then we discuss some of the non-sleep CPAP treatments, as well as this new therapy called Bongo RX, which is expiratory positive air pressure. It's essentially a little valve that when you breathe against it, you generate your own positive air pressure versus having a machine blow pressure into you. Much smaller, much better access to care. Then we also have an algorithm that we discussed for the treatment algorithm for the dental office. And then we go through the impacts of the ADA. So there is that video to be reviewed at your own leisure on the Sleep Balance Academy that goes through this whole topic more in depth.
Yeah, we have the extra examination forms for an in-depth examination for those doctors who want to learn more about sleep apnea. Thank you.
Yeah, and their teams. Yeah, really, if the team isn't familiar with this process, it will not be implemented. So we do know that the dentist obviously needs to be well informed, but if the allied dental health professionals and the rest of the staff are not familiarized and given the tools to implement this, it won't be successful.
Yeah,
in my opinion.
exactly.
Yeah, you're right, 100%.
So dentists may be willing to pay for their, if a hygienist is interested in getting comprehensive training in sleep apnea care, the dentist may be willing to pay for their membership in the Sleep Balance Academy, which we will help them go through and implement in their office. So
Okay.
that's it.
You know what we've also been offering, and we've noticed this with a couple of offices who the dentists have invested considerably in their own understanding of dental sleep medicine, but then they said in their practices it wasn't fully implemented. Since we've been doing this for a long time, we have a mentoring program that we can actually personalize what your treatment or your action plan should be based on where your current office is.
Mm-hmm.
We've also got some information on how chiropractors can become DME providers and be able to do a lot of this care as well and partner with us as dentists. So we really believe we got a new model that no one else is doing that is unique. We're actually committed to reaching the 54 million people in this country who are undiagnosed, walking around, and is not being addressed at all by centralized sleep medicine, sleep care, and also by the well-established dental organizations that teach sleep apnea care, which are really not reaching out either to get to these large patient population. It's probably the single most important impact that we can have on our country's health that I can think of.
Absolutely. That is, it's definitely a chicken and egg discussion when you start talking about oral pathologies and diseases. And it's really inspiring process to take a team through this aha moment, because look, we all at one point in time scratched our head when we'd see a certain type of bruxism, and patients would say, well, I don't do this with my jaw. And we'd say, I can't imagine you are either, but let's stick a night guard in there, right? And make it worse. So it's a great process to watch with the integration. The other thing is there are some organizations, as you know, who are putting some good effort into this. Others are really focused on chasing the dollar, in my opinion, versus chasing the patient's health. But I like this wellness. It fits into our wellness driven model. So this is really nice.
Well, thank you, Cindy. Appreciate that. Yeah. Well, I'm glad you came on. So anything else to say, Joe, before we wrap this particular segment up?
maybe it's coming, but one of our challenges that we still face is reaching the medical professionals on the other side. So, I'm teaching them how to screen and refer, and then patients tend to get lost in the abyss.
Yeah.
So there is that, and we've really been working hard on that. The other thing is, there were two things. Oh gosh, it came to me and I didn't write it down, Joe. It'll come back to me. It'll come back right when you get deep into conversation on something important.
I know. Subconscious.
Well,
Yeah.
I think that's one of the most commonly asked question in the motivated dental team is how do we engage our fellow clinicians and getting this sort of reciprocity going.
Right.
The one challenge everyone has now that was not the case a decade ago is everyone's realizing sleep apnea is a big problem, not just dentists and dental teams, but even primary care
Mhm.
and other specialists. And so now the sleep specialists, which is a very small group of them, is the bottleneck.
Yeah.
It's limiting access to diagnosis and treatment. And with CPAP still being 90% or more of treatment provided to American patients, you're finding that they're really, really inundated with their own workload. So in the past, when a sleep specialist was going to be really appreciative of the dental team referring and then trying to get that patient back for care, a lot of them are really not spending as much time as they could looking back at filling that circle up of sending them to me and I send them back to you sort of scenario. They're just keeping their head above water. So the reason why I brought up the online homesleepstudy.com and other websites out there, if you can have a team of sleep specialists that are going to integrate into your current system, who believe in oral appliance therapy as well as CPAP and surgery when it's appropriate, then what you could do as an actively screening practice, and there's lots of reasons for this. The three top ones are either it's a small community and you have limited access to official diagnostics. It's a big community, but those sleep specialists are inundated and those hospital systems are inundated and you're not going to get them back in a timely fashion. Or say, like in Portland, many sleep specialists are just not big fans of oral appliances. No matter how much education you give them, they're really going to focus on CPAP. Now you have to be the champion for your own patients because the patients that you're seeing like the research. If you give them a balanced, informed consent, you tell them, hey, I want to give you a treatment that's appropriate for you. We found that you have mild or moderate sleep apnea. You have the option of dental appliance or CPAP based on your insurance coverage. What would you like? Well, the research has shown that almost 85% of patients say, well, if I'm appropriate for it, I'd like to try the dental appliance first. That's not how many sleep specialists look at this.
No.
And you can see that by the practice patterns. Now, that's in America, okay, in the United States. In Europe, many places in Scandinavia, the oral appliance recommendations are as high as 70% and 30% CPAP. So again, if you follow the research, you'll start changing the way you practice. So how do we do that? The dental team screens, finds for high likelihood of possibility of sleep apnea. And then they work with either having the equipment in their own office or with a team that actually can provide convenient home sleep testing with a fast turnover, should be within a few days or a week maximum. And then a sleep specialist who is open to oral appliance therapy, a champion, can give a recommendation for CPAP or oral appliances or other treatments based on what the patient's needs are, and have that recommendation in the actual study. And now, within a week, you've got that feedback, you've got the mandate to treat that patient, and you can move forward, okay? You can still at the same time be reaching out to your local sleep specialist and trying to do a great job of treating their patients that they refer to you, or those patients that have to go to the sleep specialist.
Yeah.
There are several patients that you cannot manage appropriately in your own office. Specifically, I wouldn't suggest treating Medicare patients through your home sleep testing personally. I would suggest sending them to the sleep laboratory, having them manage that and officially get them back to you so that they're actually managing the process in a separate fashion, because you don't want to mix diagnostics with treatment. Okay, we've always been that way with sleep app machines. In a sleep lab, either you choose to be a diagnostic center for Medicare, or you choose to be a durable medical equipment provider or CPAP provider. You do not do both. Okay, that's crossing over services.
And another thing
So
about
that would be
Joe,
a very
yeah. So Joe, what Joe said about the homesleepstudy.com website is that we have physicians that diagnose those sleep studies that are licensed in all 50 states. So
That was my question. Thank you. Okay.
You can get authorization for a CPAP or an oral sleep appliance from that study that is appropriate. Now, what Joe said about Medicare is true too. You don't recommend you do Medicare that way. They have to have a PCP face-to-face before they can even get the study.
Mhm.
So they're not going to get paid for it if they don't go through the PCP. Very good. Thank you, Joe.
Yes.
yeah.
Yeah.
Did that give you a chance to think about another question there, Cynthia?
No, it did not come back to me. I'm embarrassed to say, which is a good lesson for me to keep the pen in my hand. So the blueprint, one of the things, and I apologize, Dr. Downs, for not getting this to you today. My day did not go as planned. So my appointments got moved in until 6 o'clock tonight. So I'm going straight through today, but I will get everything together in a folder and send to you. The blueprint that we've put together for it includes ways to go out into your community, ways to create an event to bring these like-minded professionals. I did remember. See, I told you it would come back.
Yeah.
I just wrote it down. How to bring them in, and then also the cross-pollination for marketing. That's a really wonderful attribute that people discover once they've established these relationships. CMU, is there anybody that you know that has access to medical health care, continuing ed?
Joe, I know.
So you're hoping to have access to medical health CME for the dental team, or for your medical providers that you're reaching out to?
For my allied providers, because, and here's why, I've held in the past a few events where doctors come. It's been very, I was part of a sleep organization that was doctors and dentists, and they brought me in as their auxiliary person. Interestingly, what I've discovered, even in this group that was really focused and really intentionally putting forth this idea, there was still this, from somebody on the sitting in the back of the room, there was still this tension and, for lack of a better word, these big egos that couldn't come together the way they really needed to. So we started doing our own events with people that really had expressed interest through the right channels, and they asked about continuing ed units, and I don't have them. I said, sorry, but you're getting a great course. And that's something that I've been exploring, but it's been honestly on the back burner.
Gee, I'd love to have you explore that further and find out what we could do in that area, because we would love to provide CME to medical providers.
Yeah, so the hospitals, and I can kind of give you some guidance there, and we all have physician friends.
Sure.
So that actually is where I started 6 years ago, was with my physician friend, and it just sort of exploded. The other thing that I wanted to share with you is our system of screening is very it's a process, and it's sequential for very specific reasons, because not only sleep breathing disorders, but we're also looking at anything health related and any infection, any inflammation. So they follow this, and of course there's lots of pushback. I've had to take out the stopwatch and say, no, this really only takes 28 seconds. Okay, so now we can move beyond this. However, a really great dovetail with this screening is when they're doing their oral cancer. And I think Joe, you mentioned that earlier, wasn't Dr. Downs? But this this is perfect timing for that in terms of efficiency for the clinician.
So let me hold on a
You can
second.
absolutely do that at the same time. There's no reason to do a separate examination. You just think of it while you're doing it, you know?
Absolutely, absolutely. And it's the same thing with that Carrie's risk form, that was 3 pages long. People weren't doing it, but if you just look at the health history and look at the patient and do a couple of things, you get your answer. So anything that can be done to remove a line, remove a step, you'll have more ears.
Hold on just a second. I'm gonna keep you on the line, Cindy, and then I'm going to pause and end the recording on this because I think we've got this part done. So here we
Okay.
go.